So at this meeting, we presented the results of a pool analysis of 4 large trials that were really conceived over 15 years ago, comparing what at the time was the main interest in transplantation myeloma, was to compare tandem autologous transplant and versus tandem autologous followed by reduced intensity allogeneic transplant. Those trials have all been published before and they show some conflicting results. What we want to do is pull them all together with longer follow-up and try to perhaps definitively answer that question. So we're able to present data on over 1,300 patients with a median follow-up closer to 10 years among the surviving patients. And what we saw was, even though there was higher non-relapse mortality on the patients who receive an allogeneic transplant, that was counteracted by a much lower risk of progression. And to our surprise, the survival after progression was greater, much greater on the patients who received prior allogeneic transplant. Overall, there was a slight survival advantage for allogeneic transplant and a slight progression-free survival for allogeneic transplant. While this might not necessarily change the use of allogeneic transplant, there are many other competing interests and competing therapies in myeloma. It teaches a few important messages that those comparisons between auto and allo really require long-term to mature. And the graft versus myeloma effect, which is the promise on allogeneic transplant in this disease, remains for the remaining of the patient life and possibly synergize with other myeloma therapies that the patient uses after relapse, therefore explaining the post-relapse survival.